So next up, a talk entitled A Missing Piece of the Parkinson's Puzzle, the critical role of the dietitian in the care of people living with Parkinson's disease. And the presenters here are Richelle Flanagan, who's going to be joined by Indu Subramanian from Ireland.
Okay, good morning, everybody. This is not intimidating. Seeing so many people, I think it's the most I've ever spoken in front of. I'm really grateful to be here today, presenting on a missing piece of the Parkinson's puzzle, the critical role of dietitian in the care of people with Parkinson's. So there were three people involved in this abstract. Myself, I'm a registered dietitian, a WPC ambassador, and Indu Subramanian, who is an MD, a neurologist, and Carly Roosh, who's also a registered dietitian, but who can't be here today. And our poster number, if anyone's interested, is 2302. So just, you know, in terms of disclosure, no disclosure, just in terms of my journey here, I attended the World Parkinson's Congress in Kyoto in 2019, and I was very excited, you know, to attend and see what nutrition research there was with regard to Parkinson's. And unfortunately, there wasn't very much at that Congress. And also, there's a breakout session on a Wednesday evening for the different health professionals. So I was excitedly waiting to meet other dietitians at that meeting, but there was no dietitian meeting. So it kind of really spurred me on in terms of wanting to sort of progress nutrition research for people with Parkinson's. So I started with my home base in Ireland, and I wrote an article in my own professional body magazine with regard to a case for the greater nutritional care of people with Parkinson's. Because through my own research, I really see that nutrition can play a huge role no matter what age or stage someone is with Parkinson's. So that's really what led me to apply to become a WPC ambassador, was the mission to really change that trajectory. So in terms of the role of a dietitian in Parkinson's care, it is multifaceted. So we look at different diets for people with Parkinson's. We look at their vitamin and mineral status. We look at things like the protein redistribution diet in terms of managing fluctuations. We look in terms of the gut with regard to prebiotics and probiotics, drug interactions. Also, an area that's quite forgotten, but 30% of people with Parkinson's suffer from malnutrition. So enteral and also total parental nutrition is very important. Also looking at the cultural aspect of the diet. And dietitians, registered dietitians, are regularly trained in behavior change modification to help people make changes in their diet. And then also, in addition, we work with patients in terms of managing dysphagia, because the dysphagia diet can actually be low in calories, so a dietitian is a very important part of that treatment. Also, obviously, we know that many people with Parkinson's suffer in terms of smell and taste issues, and just like in cancer patients, dietitians will help in terms of improving that side of Parkinson's. Weight is a big issue in terms of whether it's weight loss or weight gain. For example, post-DBS, 12 months after DBS, the average weight gain is 6 kilograms. Food addiction is actually occurring in people with Parkinson's. We know that eating disorders are prevalent. There are issues with regard to food cravings and overeating. And then in terms of comorbidities, things like osteoporosis, thyroid involvement, diabetes, heart disease. And very much we know that there's the whole brain-gut aspect, and dietitians are very well versed in talking about poo and guts and in terms of bowel opening and IBS, Helicobacter pylori, small intestinal bowel overgrowth. We deal with this on a regular basis. And then obviously there's dealing with the mental health side as well, because diet can have a big impact in terms of mood and anxiety and depression. So just the problem there is you can see that there's a huge input that dietitians can bring, but in terms of the research showing access to dietitians, unfortunately it's lacking. But the two studies that we're aware of is the Belgian study of 82 people with Parkinson's showed that 11% of patients had ever seen a dietitian, and only 3% see one on an ongoing basis. And there was a very large Irish nationwide study done quite recently of 1,500 people that showed that only 15% had access to a dietitian, and it was the lowest of all of the therapies for Parkinson's patients to have access to. On the other side then, in terms of the importance of diet to people with Parkinson's, I run a survey, a global survey, which 154 people responded to within sort of 48 hours. And that showed that 82% of the people who answered it rated diet as important in their care, but they rated their knowledge of nutrition for their Parkinson's, 35% of them as average and 25% as poor or very poor. So we have work to do. And then on the other side, in terms of referral to a dietetic service, we asked them, did you get referred? And it reflects the research that 84% were never referred to a dietitian. And on the other side, 87% of people with Parkinson's never asked to see a dietitian. So that reflects two things. One is that there is a lack of referral from the neurologists and the healthcare professionals, and the other side is that people with Parkinson's aren't asking for, and that's a problem. If you don't ask, you don't get in health services. The other issue, which is a big one, is unintentional weight loss. So we asked people, had you lost weight loss unintentionally? And 30%, which reflects the research, lost weight since diagnosis. And weight loss, we know, appears to be associated with a more rapid decline in motor function, cognitive impairment, disability, and mortality. So this is definitely something that we have to address. And we asked then people, what do you want to know? And the top 5 areas were supplements, the diet and medication interactions, issues with gut. We know people with Parkinson's, at least 60% have gut issues. Probiotics, that's obviously reflecting the gut issue problems. And then in terms of diets, I'm always asked, what's the best diet for people with Parkinson's? And then on the far side, you see the word cloud showing you other areas that people were interested in. And I think it's quite interesting that supplements is the top of the list, because as myself as well, living with Parkinson's, like anything, when you're living with a life-limiting, condition that's progressive, you will grasp any straw. And this is an issue because people are taking supplements that actually don't have any evidence and could be detrimental. And I suppose this is quite uncomfortable, but it's really important for us to see. In terms of, people with Parkinson's, we asked them, what was your experience of asking for nutrition advice? So these are some of the quotes. I asked for a referral to a dietitian, was told by the doctor that I needed to speak to a dietitian, but was told I didn't need to. Basically, I asked a neurologist if we could look at diet. Their response is move more, eat well. And on the flip side, in terms of dietitians, we have to take responsibility in that there's a lot of conflicting advice coming from dietitians because there are no consistent clinical guidelines. In terms of does nutritional therapy work, this study shows here that basically this intervention was a 6-week nutrition intervention with a dietitian and nutrition nurse. People were given oral nutritional supplements, extra fiber, they were given vitamins, and they were put on the protein redistributed diet. In that cohort, 67% had abnormal nutritional status, 25% were malnourished, and 42% were at risk. And the poor nutritional status affected their depression and anxiety. And it showed basically that the intervention improved the malnutrition score, significant improvement in disease severity, quality of life, nutritional status, had a significant improvement in self-perception of nutritional health status. So ultimately, the author said the nutritional status assessment should be a standard approach in Parkinson's. Although further research is still needed on the role of nutrition and progression, disregarding the nutritional features in PD theoretically worsens the disease and quality of life. And in terms of dietary patterns and progression, the MIND diet is shown to have benefit. And Carly, who was one of our authors, showed that the average MEDI score of her paper was only 4.4. In the survey that we carried out, it was only 6. And generally, very good is over 10. So we are, definitely a lot of work to do. So our call to action is that we need to improve access to dietitians, provide specialized nutrition training for dietitians, and also for neurologists, nurses, and health professionals. Include the dietitian as a core member of the MDT, include the dietitians in the Movement Disorder Society in team training, update the dietetic management guidelines, increase research in Parkinson's, and provision of personalized nutrition advice with people with Parkinson's, but that's going to take time. In the meantime, we need to be signposting a lot of basic information that's going to make a big difference, the low-hanging fruit for people with Parkinson's. And I'm just going to hand over now to Indu, who's going to talk about incorporating the dietitian as part of wellness and PD.
Thank you so much. So just a shout out to Richelle and all her amazing work. I mean, she's so busy at this meeting and has put together just a fabulous sort of advocacy campaign for not just this, but many other things around women with Parkinson's. So applaud you. So I'm just here to say, really, as a neurologist who stands here humbly before you, that, I think that we can't do this work alone. We have to have the patient voice in the center, and we have to have wellness. So we have to find ways to help people living with Parkinson's to find lifestyle choices to help them live better every day. When people feel like they're part of the disease process, the solution to the disease, and they can make lifestyle choices, feel in control, that's when the magic happens. And I think Richelle and many of our colleagues who are across the multidisciplinary team are just so important in that piece. So we have this graphic that we put in one of our papers, and it shows just on the outside of these petals, and it could represent the tulip of Parkinson's, all the people, and many of you are here at this meeting doing amazing work to really sort of, hold up and bring sort of this field forward. And we as neurologists are really hopefully there to help coordinate and bring this team together. We put together this roadmap for Parkinson's patients. People have really asked for years about, what can I expect? We now can diagnose people before they can manifest with motor symptoms. And what do we offer people throughout these stages of disease? And I think we really have to be proactive and teach people about the role of nutrition, dietitians. And so we have this, honestly, from baseline of diagnosis. And we see here I think that's the last slide, that, I think really the proactive multidisciplinary approach with the patient in the middle is so important, and really thinking about all of our allied health professionals, but, bringing it back to the dietitian, really a missing link in this Parkinson's puzzle. So thank you for your attention. Come by the poster. We'd love to meet you.
All right, we actually have about 2 minutes left, so I'll ask you guys a question. So I'll come back to your call for action. We have a lot of very committed people in the room, but most are not dietitians. So what action would you ask them to take?
The dietitians?
No, not the dietitians know the answer, but the question, what about the other 95% of the audience that's not dietitians? What would you say to them in terms of your call to action?
Well, I think it's, every contact point. So, we have different health professionals out there, neurologists, is to actually ask the question, how is your diet? And to find in your local area resources that you can point people with Parkinson's to, and to start asking to involve dietitians in multidisciplinary care. And I suppose in terms of nutrition, or the research, is to start looking at research in your area as well. And would you like to say?
Yeah, and I think that, in general, if we go back to this slide, I think that we've spent a lot of time, adjusting medications and thinking about, the nuances of surgery. But I think getting back to the basics of living well every day, diet is a huge part of this. What we eat can make us feel, as Richelle had said, affect our mood, can affect, how we're going to be able to face the rest of the day. And I think we've really undervalued so many of these lifestyle approaches historically. And we just started a wellness task force at the Movement Disorder Society, which is a multidisciplinary task force, and hoping to bring a prescription to help people living with Parkinson's to live better every day with, sort of what the evidence base is right now, of which there is mounting evidence in many of these areas, and diet certainly has some evidence as well. So learning about the information, realizing that you can make proactive lifestyle choices, working with the team, and if the neurologist is too busy, figuring out who the resource is, maybe pointing to a dietitian who has extra education, perhaps sending them to a conference like this so that they can learn and kind of work together on an international level with other folks that are doing the same work, which we are trying to do with Carly, Richelle, and some other folks and I.
Just to say that I'm delighted to say this conference, we do have a breakout session for dietitians. And we have 10 dietitians here, which is an amazing improvement. And we ask those who are working or researching, are interested in nutrition research, you're welcome to come to the session. You need to register for it, but that would be great because we want to actually take some outcomes of this conference to move the dial for Parkinson's and nutrition.
All right, well, thank you. All right.